Good morning. Thank you, Maurice and Jenny and the team at Assist Foundation for inviting me here today. And thanks to all of you joining me here in Bulgaria, as well as those that are listening in online to talk about unlocking potential, the economic and social impact of high-tech AAC for individuals with cerebral palsy, autism spectrum disorder, and ALS or MND. My name is Idalie Fernandez, and I have been with Tobii Dynavox for about 6 years based out of the Stockholm office, and I'm the sales manager for East and Central Europe, the Middle East, and Africa. And I'm really passionate about building sustainable AAC ecosystems in emerging countries. And I work with local partners in various countries that support both the AAC users, but also the communities of caretakers and family members and professionals that support them. And here in Bulgaria, we work with Interacta. So we know that there are 5 main barriers of AAC, and these were formulated by Buchelman and Miranda in the 80s, and they are universal across all forms of AAC. Not all of them are solved, but this is something that we're working on reducing. And it's everything from policy and international and local laws to local practice and practice at institutions, to the knowledge and awareness of the professionals, as well as the ability to apply their skills, and also about the attitude and beliefs around AAC, fears of technology, outdated practices. There are millions of people with communication disabilities, such as autism spectrum disorder, cerebral palsy, and ALS, who require assistive communication tools to express themselves. And most of them are unaware that the technology even exists, and or they're not even eligible for financial coverage for many different reasons. So how can we reduce these barriers? Oftentimes, we come across questions from policymakers about costs and also about the benefits and value to users and to society. And we need a tool to show why AAC is critical and beneficial. Tobii Dynavox commissioned an independent health economic study earlier this year that explores the benefits of assistive communication and looks at the societal gains. It's a tool to develop improved provision of high-tech AAC for those who need it. And it's about human potential, societal gains, and driving policy changes to secure the necessary funding to make high-tech AAC accessible to everyone who needs it. And it's about making systemic changes. So why did we do this? And the answer is that there is no existing research today that supports the impact from a health economic perspective. And these measure the value of healthcare interventions by analyzing costs and benefits. And these studies, or these types of studies, are very difficult to measure, but they're also really important. They help decision makers understand if a treatment is worth the money by comparing how much it costs with how much it improves health. And this study helps healthcare providers, governments, and insurers make better decisions about which treatments to offer or to invest in, ensuring that resources are used wisely for the best patient or the best possible patient outcomes. So this type of study is essential for optimizing healthcare systems. So let's look at the highlights. We can see that an investment in high-tech AAC provides measurable returns and clear economic benefits to society, and also profound impact on the user's quality of life and their networks. So how we took on this challenge was, first, we did a qualitative pre-study where we conducted in-depth interviews and open-ended questions with the target group, exploring what having access to these tools meant for them. Then we did a quantitative study, taking the insights and results from the pre-study and turned them into an online survey with respondents from various channels, such as Tobii Dynavox contacts and various social media channels and forums as well. Then we took the data from this study and combined it with external reference data and turned that into a health economic model to investigate the costs and return of investment from a societal perspective per patient. And lastly, we looked at our target group, which is individuals with cerebral palsy, autism spectrum disorder, and ALS, who represent our biggest end user groups. And these are all users of high-tech AAC tools, which are independent of Tobii Dynavox tools as well. So it's not only our users, but users across all high-tech AAC products and solutions. So when we look at the perspectives explored, there were three main ones, which are the users of high-tech AAC to understand the direct impact on them and their lives, as well as the networks. So those who support and interact with the users, such as family members, caretakers and caregivers, special educators and therapists, and lastly, society. And this perspective examines the broader societal benefits of AAC. So let's take a closer look at the user perspective, how high-tech AAC improves and elevates the lives of those using it. The World Health Organization measures quality of life through 4 different instruments: physical, psychological, social relationships, and environmental health. So with physical health, it's the ability to communicate your health problems and needs, which is getting the right health care at the right time, but also smaller needs and discomforts for a more comfortable everyday. Psychological health explores personality, being able to express your thoughts, your feelings, to learn new things and to develop new skills, being able to influence one's self-perception and behavior. And for caregivers, this also results in their feelings of stress and worry. So it's not just about understanding the user's needs, but also the caregiver's needs and the overall life situation. With respect to social relationships, it makes it possible to communicate spontaneously and independently without another person's interpretation, which leads to improved social relationships, stronger social bonds with immediate family, but also forming relationships outside of your closest circle and participating in different contexts. So this enables also for the caretakers to get to know their family members on a different level, affecting both caretakers and users. And when it comes to environmental health, this contributes to a more functional and safer environment, both at home, but also outside of the home, providing improved independence for the users and for the caregivers who get to spend more time outside of the home and to be less tied to each other. So let's take a look at those factors that run across both the user and caregivers. And we can see here how one is able to express their needs all the way through controlling their surroundings. And we can see where it crosses over both the users and the caregivers. So now let's take a look at the main benefits of high-tech AAC for the users and also for what their responses look like. 86% feel that they can express their needs and their preferences. 72% feel that they're encouraged to communicate. 69% are able to form and maintain social relationships. 68% can express one's personality. 55% feel that they can learn and work. And 34% feel increased independence. And everyone in this room knows these things just from having access to and working with people who need and have high-tech AAC. But now we have the numbers to be able to show it in real life and to be able to have those discussions with healthcare providers, ministries of health, and insurers to back up all that knowledge that we already have. On this slide and in this study, we compared 2 different scenarios. It's the user having experienced a high-tech AAC tool today, which is represented in the black, And in green, it's how they estimated life would have been like without their high-tech AAC tool. And this is on a scale of 1 to 10. So we can see in every instance, there's a big gap between what life is like today with their high-tech AAC tool and what it's like without. And that's everything from being able to express their will, communicate their thoughts, develop new skills, be involved in various social contexts, communicate with people outside their circle, build social bonds with others, participate and contribute at school or at work. And what that means is that high-tech AAC doubles key communication and social capacities for the user. And when we look at estimated well-being, both mental and physical, same scale, and we look at users of CP, users with autism, and users with ALS, we can also see a big discrepancy as well between the Black and the green answers. So with a high-tech AAC tool and life estimated without that same tool. And across these three groups, we can see that well-being doubles across all of them, which is another really important statement. So the result is doubled overall well-being for the user. That's huge. So now let's take a look at the network perspective. So high-tech AAC's impact on the lives of people in proximity to those who use it, such as family members and caregivers. And this highlights improved communication and understanding within these relationships. So the main caretaker benefits of high-tech AAC show us that 88% have more effective and precise communication. 83% understand and meet the care recipient's needs. 45% feel that they can know the care recipient on a deeper level. 48% feel less stressed and worried. And 65% experience increased independence. What does access to high-tech AAC mean to the care recipient? Let's understand them a little bit better. 67% of parents with autistic children say that it means that they could get to know their child on a deeper level. 65% say that it increased independence, and also there's less of a reliance on them as interpreters for their children. And lastly, they feel less stressed and less worried. I think this quote represents what it can mean for the caregiver's perspective in a really powerful way. So this is a mom with a 14-year-old child with cerebral palsy and intellectual disability. And she says, I decided when my daughter was little not to keep working, but to only work with her. Now, 14 years later, I'm on my way out of that because it works so much better now. And also, I want something else for myself. And this high-tech AAC might enable me to do so and look for a job because I feel confident in that she will be able to express what she wants without me being nearby. That's really powerful. So we've looked at what this means for caretakers. So now let's take a look at what this means from a societal perspective. High-tech AAC leads to higher quality of life and increased efficiency for society at large. So that will be increased economic productivity, reduced healthcare costs, greater social inclusion. This means that high-tech AAC also leads to actual societal savings. So there's an estimated 10% decrease in healthcare visits and days, as well as SLP visits for users over time. Thanks to more precise communication and the ability to express needs in systems, we see this decrease in healthcare. Also, there is a 7% estimated increase in work rate for users, which means that AAC users can learn, can control their computers and their surroundings, leading to this increase in work rate for themselves, compared to not having access to the tool. It also means that there's a 12% estimated increase in a work rate for the network. That means that there's improved mental health care of caregivers that leads to the network working 12% more than if they did not have access to this tool, which is the largest savings that's to come from an increased workability from the caregivers. So what this means in monetary terms is that there is a 3-time return on investment over a 5-year period per user. So that is reflected in reduced healthcare costs, which is to say fewer hospital visits, less required specialized care, increased productivity, being able to participate in education and or work and community life, as well as improved quality of life, which is higher levels of happiness and well-being. To put this in perspective, this type of health economic models rarely ever show a net gain, only in very, very specific instances, and the costs usually exceed the financial gains. So to get this type of positive result and of this magnitude is something to really spread the word about. And we know that this study transfers to other countries. There may be some small variance, but the results will be positive. So this can help arm you with arguments to take to your healthcare providers, your ministries of health and government, and insurers to talk about the benefits of high-tech AAC to society, to the users, and to caretakers. So I will leave you with 3 main takeaways from the health economic study, and they are that access to high-tech AAC tool means double well-being and quality of life for the user, increased independence for the users and the caregivers, and lastly, an economic gain for society that's 3 times the investment. So we all benefit. Every single person in this room or online benefits from having this information. It's a win-win for everyone. So I just want to wrap up and say that this isn't just about technology. It's about unlocking human potential and advocating for equitable access, and we can transform lives together. Please share this study. Here's a QR code that you can use to download the study, read through it, and share it with anyone that you think would benefit, including your colleagues and peers, institutions that you work at, your insurers, healthcare providers, family members. Everyone should take a look at this. And let's together demand more and better. Thank you very much. I hope this session was helpful. And if you would like to get in touch with me, you can use this QR code to access my details and contact me directly. Thanks again, Maurice, Jenny, and the team at Assist Foundation.